Mr. Speaker, the 2025 annual report of the Bermuda Drug Information Network, or BerDIN as is known, marks the network's 14th report. This annual report serves as an update to the previous year's report and was officially released at the annual BerDIN meeting held on November 28th. The report offers a comprehensive tabular summary of Bermuda's drug landscape, categorized under the following themes: criminal and suspicious activities, imports, exports, and licensing, training for intervention procedures, or TIPS, substance abuse treatment and counseling, drug screening surveillance, impaired driving, health, drug prevention programs, certified professionals, survey data, and financing drug control. Mr. Speaker, historically, monitoring drug use presents a challenging and intricate issue. The data included in this year's publication, contributed by significant industry stakeholders, compares the years 2023 and 2024 across 10 chapters and offers timely information regarding efforts to reduce the impact of substance misuse within the community. The data is organized in tables, accompanied by a narrative overview for each subject. National, culturally appropriate data is provided on the nature and extent of both legal and illegal substance use within Bermudian society. This publication represents a compilation of efforts from a wide range of agencies and departments involved in drug prevention, intervention, treatment, counseling, rehabilitation, enforcement, interdiction, and health. Despite the challenges placed on data providers over the last 2 years, BerDIN remains a central source of drug-related information that serves a critical role in informing policymakers and the public about the drug situation in Bermuda. Because of its multidisciplinary, multi-source approach, which employs a multi-indicator system, we now have over 15 years of information encompassing different aspects of the drug problem in Bermuda, from issues with health and the social impact of drug use to the financial burden it bears on our community. Mr. Speaker, the Counseling and Life Skills Services program, overseen by the Department of Child and Family Services, has reported a 21.1% increase in youth substance abuse treatment referrals, although only 6.5% of these individuals receive services. Regarding adult substance use, there has been a growing demand for services among both new and returning clients at the Bermuda Assessment and Referral Center, or known as BARC. In 2024, a total of 74 new clients were accepted, an increase from 62 in 2023. Additionally, the number of repeat clients, those returning for assessment or referral, rose by 27.5%, increasing from 66 in 2023 to 83 in 2024. And those seeking assessment exhibited more severe substance use disorders compared to the previous year. In terms of the substances chosen by individuals seeking treatment for substance use, alcohol and cocaine, followed by marijuana, remained the primary substances for which people sought treatment over the last 2 years. Mr. Speaker, in 2024, the Drug Treatment Court documented 22 new referrals, a slight rise from the 18 referrals recorded in 2023. Out of these, 8 individuals were admitted into the program. For the DUI court, there were 31 referrals in 2024, leading to 11 admissions. Similar figures were noted in 2023. When discussing the use of narcotic drugs, it is frequently associated with crimes related to or induced by drugs, as outlined in the relevant chapters of the publication. Reception inmates in the Department of Corrections consistently exhibit the use of illegal substances before their intake at the Westgate Correctional Facility. The total number of positive test results increased, with 109 positive screens recorded in 2024 compared to 82 in 2023. The drug of choice before incarceration continues to be marijuana, followed by cocaine and opiates. Polydrug use, using multiple drugs simultaneously or in succession amongst those tested, increased from 26 in 2023 to 35 in 2024. Mr. Speaker, the Department of Health, via the laboratory, has reported that in 2024, a total of 48 cases were examined for the presence of or absence of drugs in suspicious deaths, with the majority being males, 37 cases. The majority of screenings were conducted on individuals aged between 46 and 60 years. Out of the 48 screenings conducted in 2024, 10.4% or 5 cases tested positive for excessive ethanol or illegal non-prescribed drugs. Detected substances included THC, cocaine, codeine, morphine, and others, often found in combination. In contrast, alcohol alone was implicated less frequently. In 23 cases, ethanol was detected below the legal limit, or no substances were detected at all. Mr. Speaker, in the past year, the Bermuda Police Service has indicated a rise in both drug and cash seizures. In 2024, the BPS documented 693 enforcement actions leading to the confiscation of 309,574.17 grams of illegal drugs, a significant increase from the 55,492.19 grams seized in 2023. Cannabis was the most commonly seized drug, with loose cannabis alone comprising of 158,605.30 grams. Cocaine and heroin, diamorphine were also among the key substances confiscated, in addition to synthetic drugs like MDMA and methamphetamine, which continue to pose emerging challenges for law enforcement and public health agencies. In 2024, the BPS reported 2 cash seizures totaling $639,822, marking a significant rise from the previous year. Of these seizures, $228,000 was officially forfeited, in contrast to the $90,340 forfeited in 2023. Additionally, in 2024, $411,822 was seized under Section 50 of the Proceeds of Crime Act 1997, compared to $18,000 in 2023. Mr. Speaker, the Customs Department has reported that slightly more than 5 million liters of alcohol were available for consumption in 2024. In terms of drunk driving incidents, a greater number of males, 68, provided samples for testing in comparison to females, Ms. Ted. The majority of failed tests in 2024 involved 31 individuals who were found to be between 2 and 3 times over the legal limit. In contrast, 7 individuals tested within the legal limit, a decrease from 16 in 2023. The year 2024 saw 1,463 road traffic accidents, of which there were 194 accidents, or 13.3%, in which drivers exceeded the legal limit of 80 milligrams. 4 accidents in 2024 involved drivers whose blood alcohol concentration levels were 3 to 4 times the legal limit, while 2 drivers exhibited levels exceeding 4 times the legal threshold. As a reminder, the legal limit of alcohol in blood while operating a vehicle is 80 milligrams. Mr. Speaker, the key messages are as follows. The health, social, and economic harms related to substance use continue to be substantial and preventable. Alcohol is the most widely utilized substance, followed by cannabis and cocaine. The opioid use rate has stayed consistent over the past 10 years, whereas synthetic substances, especially synthetic cannabinoids, are emerging as a new issue. Despite health warnings, cannabis use during pregnancy persists, underscoring the need for continued prevention and education initiatives. At the same time, the average blood alcohol concentration of drivers involved in traffic accidents shows an upward trend, indicating ongoing difficulties with impaired driving. Additionally, toxicology screens conducted in 2024 indicated that 4 people who died as a result of a transport accident had alcohol and/or other substances in their system at the time of their deaths. Mr. Speaker, while resources are still being allocated to limit the entry of drugs into Bermuda as part of a comprehensive and balanced strategy, there is also an important acknowledgement of the need to equally reduce the demand for drugs, which remains unchanged. Significant challenges continue to exist in the island's ability to effectively address the needs of substance users, their families, and the wider community. The increase in synthetic drugs, along with the continuous availability of alcohol and the ongoing issue of impaired driving, indicates that prevention and enforcement strategies need to evolve together, underpinned by current intelligence and interagency cooperation. Mr. Speaker, these are only a few of the highlights from the 2024 BerDIN Annual Report. I encourage you and honorable members to review this report at your convenience for a more in-depth account. I would also encourage the general public to go online to review the report. The BerDIN will continue to serve as a national mechanism for tracking, analyzing, and reporting drug-related trends, bridging evidence and action. A resilient, coordinated approach, one that values data, compassion, and collaboration, will enable Bermuda to protect its people, strengthen families, and sustain communities for years to come. Thank you, Mr. Speaker.